Welcome to this week's Two Things. I'm Will Curry, Chief Medical Officer. I'm here with Aalok Agarwala, Associate Chief Medical Officer and VP of Quality and Safety, and Haytham Kaafarani, who's one of our Medical Directors of Quality and Safety. And we wanted to talk to you today a little bit about some of the work that we're doing in reducing mortality, both MGB-wide and in particular here at Mass General Hospital. We measure mortality by a mortality index, where we look at the observed mortality on our inpatients, those patients that actually pass away for any reason, versus the expected mortality, which takes into account case mix index or relative risk of passing away. And so we are working on both. Many of you are familiar with some of the work we've done on expected mortality, and that's mostly based on our documentation, how accurately our documentation reflects the complexity of the patients that we see. And you've heard of the CD tool that we use and some of the other support systems that we put into place, including AI-based programs, enhanced coding initiatives that help us better define the risks associated with the patients that we treat. We want to talk today a little bit more about some of our efforts and the observed mortality that is reducing the number of patients that actually die, including putting into action an early warning system for patients deteriorating on our floors. Early warning system, which we'll refer to also as EWS. And I wanted to let Aalok start off with the description of that.
Thanks, Will. We are really excited to be the first hospital across Mass General Brigham to be launching the early warning system. This EWS is intended to be a pre-rapid response activation system that helps get the right clinical resources at the patient's bedside before a patient starts to clinically deteriorate. When this works, as we've seen at hospitals around the country, unexpected inpatient mortality can be decreased by 15% or more. We are really excited, as I said, to have launched this program on June 3rd, and I'm going to hand it over here to Haytham to tell us a little bit more about how it works, what it is that we're asking of folks, and some of our early results.
All right, so to rescue patients who are deteriorating, there needs to be an interplay between three parties: the nurse by the bedside, the responding clinician, and the attending physician. How does it work? The nurse will get an alert that's made from automatic algorithms within Epic that detects that the patient's vital signs are deteriorating, and the nurse then will use their judgment on whether to activate or whether to decline. There would be declining if it's an inappropriate alert for vital signs that are in error or things that are already known about the patient. But if they activate, they will page the responding clinician, and they will document in their note as well. Responding clinician has 5 tasks to do. They have to respond to the nurse within 10 minutes. Them or a delegate, if they're busy, for example, they are in the operating room. They have to evaluate the patient by bedside within 30 minutes. They have to escalate within their channels of command, whatever those channels of commands are in their respective services. They also have to notify the attending physician within 60 minutes of the alert, and they have to document the note, and that happens through a dot phrase called .ews event. And what they ask from the attending clinician is to really understand that this is now a systematic response, and they need to provide the psychological safety for the responding clinician when they are contacted. That's one. And number two, which is probably going to be true in every single patient, they might have some insight to bring to the responding clinician on how to rescue these patients better. So the good news, as Aalok said, this has been live since June 3rd in 27 units, med-surg units across the hospital. It does not apply to the ICUs or procedural units or the PACUs. It's been live, it's been going very well. The feedback has been overwhelmingly positive. We've also had some feedback that helped us adjust the program as we go, so we look forward to hearing from you. Please feel free to contact any of the 3 of us if you have any concerns or if you have any suggestions on how to improve the program in the future.
I want to thank both of you for a lot of hard work and the team effort that's gone on to building this early warning system. I'm particularly excited about it for a couple of reasons. Number one, this is actually meant to prevent deterioration of our patients. And so we hope that it fires frequently and accurately, and we're always looking for feedback. But we want to prevent patients from having to go have a rapid call or to go to an ICU if we can intervene early. And second, it really helps us overcome some of the barriers and limitations of like our most modern communication systems that are keeping people away from the bedside and brings the right clinicians face to face at the bedside for interaction. So I think this actually would be very supportive of our teams of nurses and our teams of responding clinicians and helps foster a collaborative environment. So I'm really looking forward to it being pushed out, continuing to be pushed out and normalized in our systems. One last question, what else, if people want to learn more about the early warning system, how can they do so?
It's a great question. So we're happy to share as much information as you all want to hear. Haytham and myself and others have been making the rounds with many of your department meetings to talk about this. We have a health stream module that we have assigned to all of our nursing staff and to our trainees and APPs, and will be coming for many of the attending physicians as part of the MGPO QI incentive program as well, which will give some more background and details around how this works. And there's a page up on Vitals that we will link to as well with more information about the early warning system, some of the background behind what it is that we're doing, why we're doing it, how it works exactly, so that if you want to get more information, you can have that and even be able to print posters and things like that directly from the Vitals page. So.
Fantastic. Thanks again.